Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. It is Tuesday, October 26th, and I am excited, elated. As you see, there's a different graphic in the background. Today is a culmination of a few months of, actually months of talking, meeting, Zooms, and I have some guests I'm going to bring in the room in just a few moments. On Tuesdays, we typically do Testimony Tuesday, but we are going into a new venture, as you see here, Your Healthy Java, a partnership that is being supported by the Massachusetts General Hospital, the Office of Equity and Community Health, which is led by the wonderful Joe Betancourt, who is the Senior Vice President, I believe, for Community Health. I will get that absolute once my guests come in the room, but I just wanted to say good morning to everyone. Just a couple of good mornings to everyone. Let's go in real quickly, and I will try to vary this up. Sister Debbie is in the room. Also, we have to shout out our good friend and brother who is saying hello to Miss Diggs this morning as well. I thought I saw that a few moments ago. There it is. Props is saying hello to Miss Diggs. So I'm going to bring in my guest right now. I am very excited. I'm trying not to be a little emotional because I am very aware of the benefit of what this partnership is getting ready to do for not just the city of Boston, but greater Boston and beyond. We are partnering with one of the world's top hospitals, and I had the pleasure of working there some years ago, and we'll talk about that in a few minutes. But I would like to present to some and introduce to others. Both of these folks have been in the Java Cafe previously, and so they're not strangers, but I would like to first start and ask Cindy Diggs, who is not a stranger to the community nor the Java Cafe, to introduce herself and say good morning. And then Dr. Alabre, we have a short video presentation by our Senior Vice President there at Massachusetts General Hospital. And then we're going to get into the partnership and then getting to also just some context to what MGH is doing, as well as we're going to end our segment today with an opportunity for you to get updates about what's going on with the vaccination and the booster shots, just to give you an example of some of the things that we're going to offer during your Healthy Java. So I will shut up at this time and ask my good friend and sister, Cindy Diggs, to please introduce herself.
Good morning, everyone. Good morning, Java family. So my name is Cindy Diggs. I'm the Community and Cultural Engagement Manager at Mass General Hospital in the Office of Equity and Community Health.
Okay. And I thought Cindy was going to say a little bit more there. Cindy, oh my goodness, you're doing well. And Dr. Alabre, please introduce yourself as well.
Sure. Hi, good morning, everyone. And I am Claude Alabre. I am an internist at Mass General Hospital. I work in primary care, and I also work with the Office of Equity and Community Health. We are starting a partnership, as you just heard, with Java, with Jimmy, for a health segment, which we will hopefully be doing every other Tuesday or thereabouts, to discuss different topics, different areas of concerns that the community may have, questions, and hopefully provide you with the best information that we have and help answer your questions.
We're going to get into that and an example of that toward the end, Dr. Alabre. But I just wanted to say that I used to work at Mass General Hospital, and I had the opportunity of work.
Little plug.
I had the opportunity of working with a lot of the faculty there and the staff, and from the housekeeping, janitorial staff, all the way up to faculty and attendings. And it is a wonderful staff there and people that are committed to our health across the board. But you're going to hear more about Mass General's commitment to working in Black and Brown communities. And certainly at this time, it is most apropos that we ensure that we have accurate, real-time relevant information. And so we'll get more into that in a few minutes. But Dr. Joe Betancourt, who is the major facilitator on the MGH end of this, making sure this happened. I'm going to ask Cindy to put in the private chat everybody's name so I don't forget. But he and his staff have overseen the process of this support coming from Mass General into the Java Cafe. And so at this time, we're going to hear from him via a pre-recorded video presentation because he's currently in clinic. He's at the hospital taking care of patients. And so he thought it was important to greet you, give some context to the partnership. And so we're going to hear from him right now. Do me a favor, though, if you're part of the Java fam, or if not, if you're just tuning in, to everyone that's listening for the first time, we welcome you into the Java Cafe. And we hope that you were here not only for your Healthy Java, but other days as well. And so we're going to hear from Dr. Joe Betancourt at this time. Hey, everyone. As I previously stated, Dr. Betancourt was not able to be with us live this morning. He is with his priority, number one, patients, but we were able to get him in to talk about the importance of this partnership and relationship. So first, Dr. Betancourt, please introduce yourself to the Java fam and community. Tell us a little bit about yourself and what you do there at the hospital as well.
Great. So first of all, thank you so much for having me. I'm thrilled to be a part of this. We're thrilled to be a part of this, and we're thrilled because of you and because of your listeners and because of the community. You know, this is really important to us, and it's just been such a pleasure getting to, know you over the last couple of years and just the role that you filled in this space around just, being real with people and communicating. That's exactly the type of partnerships we want. So we're with you. We're with you for the long haul here. It's an honor and a privilege to be here with you. I'll just say a couple things. So I've been at Mass General now for about 20 years, just celebrated my 20-year anniversary. I'm originally from New York City. Don't hold that against me, but more originally from Puerto Rico, and that I'm going to own. So my grandparents came from Puerto Rico in the late 1950s. Traditional immigrant story. My grandfather opened up a bodega in Spanish Harlem. My grandmother worked in the sweatshops in the garment district. And so, my journey towards healthcare and to being in this seat I am today is a journey of incredible sacrifice, some luck, some preparation, but I live every day honoring all those before me who carved a path for me to be able to even dream about being here. And I say that because, I do believe that lived experience, growing up, having young parents, facing a lot of the challenges that we all know we faced and I faced in my community, growing up. It wasn't easy, but I care deeply about this work. And I care deeply about our communities, and I've devoted my career to it. So I get a chance now in my role. I'm Senior Vice President for Equity and Community Health at Mass General. Been in that role just since December. I've been a primary care doctor ever since. I'm in my office, and right now when this is airing, I got patients in here, and I also have been involved with our Center for Diversity and Inclusion, created a place called the Disparity Solution Center. So a very long way of saying that, my entire career has been devoted to quite simply figuring out how we can make sure we're delivering high quality care to anybody who enters our door, no matter who they are, where they're from, and how we engage communities around health and wellness, and do that in a way that's thoughtful, and do that in a way that is engaging, and that listens and leads by listening and sharing. And I guess I'd end by saying that I've had the privilege over this last year and change to lead our Mass General Brigham equity and community health efforts around the COVID response. And it's been hard and it's been a challenge, but we're doing our best and have done so much. And it's partnerships like this and the importance of good information and information by trusted people. And I know we have to earn that trust. Me just being Black and brown don't automatically just get that trust. We have to earn it. I understand that. But I hope that your listeners will give us a chance, because we're going to put together a roster of people who care deeply about the community, going to be real, going to share real information. And so this is our journey. And this kickoff means so much to me. So that's what I do. That's why I do it. And we're all in. And we want to be a solid community resource.
Well, Dr. Betancourt, there's nothing really much more that I need to say outside of the fact of thank you for this opportunity. Thank you for my friend and sister who's here with us, who we've heard from and going to hear more from, Cindy Diggs, for giving her the opportunity to contribute with all the others. I won't get into all of the names, but I'll try. Natalie, Leslie, Cindy, Dr. Alabre, of course, he's going to serve as the medical director, or is serving, and you've heard from him, and we'll hear from more from him, serving as the medical director. But there are some great folks there in the office that are making this happen. And as a former employee of MGH, I am especially excited. I started there as a temp, and to now be at this point in partnership with one of the world's top hospitals is very humbling, sir. So I appreciate this opportunity. I look forward. You've said many a times, and I've talked to Dr. Betancourt a few times on Zoom and in person, and the passion that I just saw when he was talking about his patients and what he's doing, sir, it really stood out. And so we're glad to know that there's someone like you at the helm, leading partnerships like this, still seeing patients and bringing on good staff to make sure the diversity is not only in the staff, but also in these partnerships and getting messaging out. So I'll end with that part. Anything else you want to say, Dr. Betancourt?
No,
I'm really appreciative of this partnership and support.
Yeah, really excited. And I too want to acknowledge the team. We put together a great team here. And at the end of the day, we're going to work with you. We're going to work with your listeners. Yes. And you all are going to tell us what you want to hear about. We're going to find top talent here who shares, that lived experience, who we believe will earn your trust to give you information that's clear, that's direct, that's real. And so we're going to take this journey, anywhere the community guides us, Jimmy, with your partnership and your leadership. So, I can't say enough about how important this is to me. I think in our work, when we started building out this vision, doing more work in Black and brown communities, digging in, is my biggest goal. And so, I live every day with this idea that, my parents passed on to me, treat every person, every community member as if it were me and your mom, right? That's the ethos on which I was raised. And that's real for me, and it's real for us. It's real for our team. It's real for us here at MGH, across our system at MGB. And this is just the beginning. So please, engage with us. This will, kind of grow and change. But it will be under your leadership, Jimmy, and we will be here to support and provide that information as the community needs it. So I'm thrilled. Enjoy, hearing from my colleagues, and off we go. Off we go.
And I saw your tweet last week that said, "Let's go." And
That's right. That's right.
Betancourt, thank you. I'm going to let you get back to your patients, and we will definitely, one of these times, I'm going to make sure Dr. Alabre schedules you to come back as one of the guests and talk about from a whole clinical perspective. I'm waiting to hear your clinical insight into some things. So thank you, Dr. Betancourt. We really appreciate you.
I appreciate you. And thank you to all your listeners and to my entire team and for your leadership. I appreciate it. You all have a great day.
Thank you, sir. Everyone, that was our greeting and formal sort of announcement from Dr. Joe Betancourt. And so, as I said in the video, I've talked to him a few times, been in some Zoom meetings with him. And I don't know if you saw on Cindy and Dr. Alabre, you can just nod or agree. There was a different level of passion and you all work with him, so maybe you've seen it before. But for me, seeing him talk about his experience was definitely a good indicator that he is dedicated to this. And so at this time, just to let you know, we're going to be here for an hour every Tuesday. We may go a little bit over today for the announcement. But Cindy, you are at MGH. You've been at MGH for a few years now. You've went through the trenches. You can tell your own, it's Testimony Tuesday. And Cindy was messing with me because I said that sometimes I ask for a whole dissertation and then I tell people they have to do it in 30 seconds. But Cindy, tell us a little bit about your journey at MGH and how you got into this position to really take your years of community experience and now work with one of the world's top hospitals to really ensure that there's a liaising between corporate health entities and the community, specifically, as Dr. Betancourt said, Black and Brown communities.
Sure. So, James, as you said, it's Testimony Tuesday, and some of my colleagues at Mass General don't know this, but you're the reason that I'm at Mass General. I can remember transitioning from my work in hospitals and community health centers, working primarily with adolescents, and really growing tired of having to stop that work because it was grant funded and I just couldn't keep disappointing young people. So I decided to take a break and was consulting. And when I was ready to go back to work, you were the one that told me about E&CH temps. And I did that work. I was hired on after a few months as administrative coordinator and got to work with a wonderful team of clinicians, the hospitalist team and the hospital medicine unit for 5 years. And then during the pandemic, I worked with the Feeding the Frontlines efforts. And you know the story that I realized that there weren't any Black-owned restaurants involved. And so I saw a post on Facebook by Diane Wilkerson, and saw that this was an issue that the restaurants in our communities were suffering. And so I responded. We set up a meeting with Soleil and a Taste of Eden, and the rest is history. I've been in Nubian Square for the past year and a half trying to get business back into that community, because as a grandchild of a woman who worked at Robel's, my aunt worked at Robel's, I just know that that's the place that we went to shop, and that was our buzzing area for our community. If you didn't get your first bangles from a Nubian Ocean or Calvi's, or get your Adidas from
Name belt.
your name belt, your Adidas from Alpha and Omega, I mean, that was the place to be. And I'd like to see that come back to fruition, because those are family-owned businesses in that area. And I came to this position by putting together staycation cruises. If you remember, our docs weren't able to go on vacation during the beginning and the surge. So I created this space in Nubian Square for them to come and have lunch and sit in on talks about racism inside of Soleil Restaurant and inside of Dudley Cafe. And they shopped at Final Touch. We shut down or opened up, I should say, the businesses on a Sunday so that we could have private time in the area and help them to keep their doors open realistically. So, and once the surge hit, we had to stop bringing the docs out because they had a lot of work that was so overwhelming that I started to ask my friends to come out. Every Saturday, I asked 20 of my friends to come and spend $20 in any of the stores in that area. And so Dr. Betancourt had come to the first staycation cruise. I worked with the Center for Diversity and Inclusion to put that together. And he liked what he saw, and he met you there.
I remember. Yeah. Yep.
And so it had been an idea that was floating on, and it wasn't until December, I believe, that they reached out to me and wanted to bring me on to the team. And unfortunately, at that time, I had caught COVID. So all of that stuff had to be put on hold. I wasn't able to interview until February. So this became very, very important for me to get this information out to the community, because I had never been so sick in my life. And I was very precautious about wearing masks and being safe. And I just knew that if somebody like me who works in this field, worked directly with the COVID response team, could get sick, then anybody else could. And so working with you and watching you work tirelessly, doing your own research and getting this information out to our community, I mean, you really saved us. I mean, because we didn't know what it was like to be at home and try to figure out what is Zoom, and trying to manage over 100 clinicians from my living room, so this is years and years of work in the community finally coming together with a team of people who want to get this work done in the community. And so I'm able to just walk into doors that they may have to wait for a long time to get into. But I believe in this team. I believe in the work that we're doing. We got so much stuff done, but we don't come in and say what we're going to do. We talk to the community. I've partnered with Roxbury Main Streets, with those business owners, and gotten their opinions on what we should do for that area, because I want to see people coming back to work. I mean, there was a point over the summer where I had to jump behind the counter at Dudley Cafe.
I was there that
Yeah.
day. We couldn't take a picture. I couldn't greet you. And Mama will go and make sure we know every detail, and her history is deep in this community. And so Cindy, her and I have a saying, and it's something that we say, don't you know Jesus? And that is just our testament to the fact that who would have ever thought you left Demick, I was coming in Demick. The partnership we did with the Federal Department of Health and Human Services at Whittier Street. So there's a long-standing
manager. Yeah.
There's a long-standing partnership, but we've never been able to do it in a manner where there's been support and the S with S with a line through it.
Right.
And so I'm very appreciative to you, Dr. Betancourt, and also Mass General Hospital. I want to bring Dr. Alabre into the conversation as well, and talk about the partnership. Dr. Alabre, if you could just give us a little bit about, your journey as well. They're getting to MGH. You are a Black man working in medicine, and you have probably experienced family members, health disparities and things like that. And so I know for you, when you came on right before Carnival, and we were expressing how we needed to really pay attention, that there was still the Delta, all of that to say, if you could introduce yourself again, and just why is it so important that we ensure, and I love what Dr. Betancourt said, and I'm going to surmise it, but I won't say it that way. But he was basically saying there is a level of trust, and Props made that comment to the fact, when he said he's from New York, it's hard to be trusted here in Boston, but MGH has a history in trying to work well. And Cindy said, being informed by community-driven processes. And so I'll shut up. How important is it to have this partnership when it comes to addressing health disparities?
Great. So I didn't say too much before, but I'll go back about sort of my journey to MGH and where I am today, because I think it's really relevant. I am originally from Haiti, so I am an immigrant myself. My family moved here about 25 years ago. Went to Boston University for medical school, and then came to MGH for residency, and have stayed on staff ever since in 2010. And so the importance of this is that I have been in multiple different areas and sort of layers of society, and dealt with people from all walks of lives. I was at BMC, as I said, for training in medical school, and certainly saw a different sort of slice of the Boston populations in terms of patient that we saw and served, and then came to MGH where it's, again, a little bit different. And I remember back then in 2007, a lot of people talked about how MGH was the hospital for the elite, and people without insurance couldn't come here. People without money who didn't live on Beacon Hill didn't come here. We know that's not the case anymore. There is certainly some history there, but things have changed a lot, and we certainly serve a very varied population at MGH, and we still have a lot of work to do, certainly, but we are putting the work in the Office of Equity and Community Health is part of that fight in terms of bringing equity, bringing diversity to the staff and to our patients, and understanding these patients and where they're coming from. The biggest story for me in terms of what got me to work with this partnership was when I was first asked to do some Q&A sessions for employees at MGH, primarily non-English speaking employees, to really just get people a little bit of better understanding of what's going on with the pandemic way back in 2020 when it first started, to give them the opportunity to ask questions. Obviously, there was lots of information, but didn't always get to understand and speak with someone who looked like them, talk like them, to get those questions fully answered. And so I was participating in a lot of those Q&As and started doing it more broadly in the community and other places. And I think the biggest question I encountered after the vaccine had come out, and there was some hesitancy, as you can imagine, about being a minority in getting the vaccine based on history, access, and lots of other factors. And the question that got me here was one of the employees asked me, commented and said that, I don't have a problem with the vaccine. I would get the vaccine today if only I could be guaranteed that when I show up there, they'll give me the same vaccine they're giving the white people. And that was really hard to hear from someone who works for an institution in healthcare, to still have this level of distrust and think that their own institution and employers would be doing something differently to certain groups. And I really didn't think we were still there in 2021. I have to say, maybe I was a little bit oblivious to the disparities and all the inequities that we are still dealing with. And it really woke me up, and it sort of started to think about how can I get more involved and help, because I also started to notice that there was a lot more people moving over to the other side from vaccine hesitancy to taking the vaccine after talking to someone, again, that they had a little bit more trust in because of factors, as we just mentioned, of being in their sort of social group in a sense, or ethnic background, or whatever it is. But there is certainly, as you mentioned before, sort of the Black and brown sort of community, having a little bit more trust. And I understand there's certainly been history behind this. We've been duped before, I like to say. But I also feel that we need to move on. We need to actually not be left behind anymore. And it is amazing to know that with the development of this vaccine, there's been so much more participation at the research level, at the volunteer level, of people from all groups, Blacks, Brown, Hispanic, whatever, to be there. And so started talking with Dr. Betancourt about how to really take this work that we did with COVID to the next level, and to now start to include chronic illnesses in prevention. And we know there's still a huge level of disparities in screening for cancer, for colon cancer, pap smears, mammograms, breast cancer, you name it. There is still a gap there between minority groups and whites. And so we're trying to see how we can use the approaches we used for COVID to bring about trust and engagement at the community level and outreach. And we'll talk about this a little bit later. We do know that people get their information in many different ways now that is different from what they did 20, even 10 years ago. And so we have to adjust and evolve and access the patients, the people where they are, and meet them halfway and bring them the right information with people that they can trust. And I couldn't be happier to know that Cindy had been in the city for many years, working with lots of different people from all areas of life, and obviously Jimmy with Jiva with Jimmy has also gained a lot of trust in the community, and being an activist and having lots of context. And this is the right audience, this is the place to be, and having these people to then trust me to hopefully gain the trust of the people, and we will certainly be bringing on lots more speakers, experts in different areas, and we hope that this will really make a difference, and we can sort of start to tackle the health disparities through health education and outreach.
And Dr. Alabre and Cindy, that is health education and outreach, and that is really and mine is to facilitate questions from the community, not so much today, but as we go forward, we're always going to allot about 10 minutes toward the end of every presentation for you, the community, to ask questions. This is your healthy Java just because of the platform, but this is really about your health. I had the wonderful opportunity of working at MGH and being in the medical. So it hit me 2 seconds. It hit me the other day, youth worker, nonprofit, and then wound up in the medical industry. Enough, Dr. Alabre, to at least be able, as the experts come in, to ask the right questions. Certainly a novice, admin, program manager in the fellowship. Shout out to all the fellows that are now attending in the pulmonary critical care fellowship over at the Brigham and Women's, which is so interesting because Brigham and Women's MGH, that was interesting. But now definitely one shout out to Mass General Brigham as well. But you ended on health education and outreach. Cindy, Dr. Alabre, for a few minutes, let's just really talk about, you mentioned health disparities. Cindy, you mentioned sort of the atypical ways that you engaged. You helped provided self-care for the docs. And Dr. Alabre, I'm going to check in with you because as a doctor, you're seeing a lot. So we want to check in and make sure that you're good. But Cindy, based on what Dr. Alabre said, you're there working with Dr. Betancourt and what they've allowed you to do to be flexible. How important is that, especially with COVID, especially what's going on with the vaccination hesitancy? You know that is, and a few other folks were beating me up for a couple of months because from hesitation to education. That was and that's the purpose of this, not just for COVID, but all information. So Cindy, what based on what Dr. Alabre said, what you've been doing, and then what Dr. Betancourt said in his video, how important is this to ensure that this information gets out in this type of new platform that Dr. Alabre alluded to?
Well, I think it'll answer a lot of questions for people because just watching the misinformation that happens on Facebook and the conversations that I've been having in the community since I took this role in May, I think that there is a lot of naysaying there. I think that there's a lot of people that are ill-informed, and it's just like playing telephone, and the conversation and the story changes 100 times. So I know that we have been out in the community all summer. Our MGB community care van has been out and bringing clinicians with them so that people can ask questions about the vaccine, express their concerns, get correct information. I think a lot of that has really helped. And the places that we show up at, I mean, you know me for years, James, I don't go to a health fair and set up a table. I'm going to a nightclub and setting up a table. I'm going to a concert.
Hold on. Do you know do your coworkers know what you're kind of most known?
You're not going to talk about that. So anyway,
it's an atypical health education model that you did, and let's just you prevented a lot of teenage pregnancy by putting teenage pregnancy prevention items in clubs, and we'll leave that there.
Yes, I worked in the HIV field for years and created a leather condom case and all that stuff, James. Thank you.
I still have mine.
But I mean, you see a couple of weeks ago, October 9th, we were in Nubian Square with the Honk Festival with all these marching bands, but we also had people getting their mammograms there. They got their blood pressure checks there. We had a full-on health festival going on at the same time, because I believe in meeting people where they're at. And if we had put on your average health fair, we might have had 50 people. We had about 500 or 600 people there checking in on their health and meeting with clinicians from Mass General, from the Brigham, from Dana-Farber. The Peace Institute was there. A lot of different entities were in the community, so that those folks that haven't kept up with their appointments because of the pandemic were able to come out and have a chat with the professionals.
Dr. Labre, let me ask you that real quick, and not being too revealing. You know, we've had conversation. We're going to actually have a session about this soon. You mentioned that there are people that are hesitant getting people back into care. You mentioned that cancer screenings and folks' dental care went array. I have a family member who was recently diagnosed with what I didn't know is such a thing, stage 0, you know, cancer. And so, away from COVID and the vaccination, we're going to end with that. But, you know, can you just talk a little bit about the importance of the correct information when it's getting people back into a mindset that it's okay with precautions to go back into care?
Yeah, absolutely. And as Cindy mentioned before as well, we do understand that there's a lot out there, lots of information. And so the idea here is to try to get people the right information, and hopefully they can trust the right people as well with the information, because we're not going to be able to stop the other information from getting out there. We can only bring what we know is consensus data, sort of the science-based data, to you. And so we hope that people will start to listen to their doctors more, or their clinics, their hospitals, and you know, the CDC and the scientists who are really doing the work. And so, as you mentioned, we do know that people have been scared, and we don't blame them. We did close at some point, and so it sort of, in a sense, sent the message that maybe this is not safe to go to a hospital, to go to a clinic, if they were closed at some point. And so now, we had to do that for lots of different reasons. We won't get into it too much, but now we're telling you we're open. Okay, so we also are doing it because we know it's safe, because we're there. Obviously, all of us have families that we go back to afterwards, and we're seeing lots of people. And if we trust that we can do this in a safe manner with the right precautions, we would like people to also believe that, we're not just saying it. It's true, it's real, and that we don't want you to miss out on your health. We don't want you to miss out on, as you mentioned, the possibility of catching a cancer really early on, where it can make a whole lot of difference than waiting till it's too late. A whole lot. And so we will be talking about this more, and maybe we'll have a little bit more data to show you what it's been like for people who have been going to the hospitals. Like, what are the number of cases that we've seen of people catching this in the hospital. And so hopefully that will help people understand the safety of doing so. And so I don't know if you wanted me to get into a little bit more of it, but really at this point, we just like to get people to start to listen to your doctors.
It is vitally important. And I can't, and you all heard Dr. Betancourt say it, Dr. Alabre has said it at least 2 or 3 times, where they're not coming without a level. And Dr. Alabre, I explained to you yesterday that I really wanted people to take the opportunity to get a sense of knowing who you are, so there can be that level of trust, because as you named, and Cindy did too, and you named that, in the past, Mass General may have not had the greatest reputation. And so now, over the years, they've worked very, 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 very hard to ensure that Cindy has the flexibility to do things like that. You all are supporting platforms in the community like this. And so one of the major reasons that we're here, and we can move into this space now, because I want to make sure, there's so much going on. As an example of what you both just said, There's so much going on with misinformation, and not even misinformation, the information, factual information, because it's based on data and science, is changing. And so it may confuse folks about, from Pfizer to Moderna to Johnson and Johnson. And so we are, and then who needs a booster, who doesn't? And let's keep it very real. A huge level of hesitancy increased when Colin Powell died, because a lot of people were taking, a lot of those that don't believe in the vax took that. And because he was vaccinated, it was lined up with, we can talk more about that later. So let's end this segment as we get ready to wrap up. We have, and I want to.
I'll just add, Jimmy. Sorry, just want to say that we know Mass General has had great reputations from the get-go, but not so much so with minority communities.
That's right.
It's just to clarify that.
Yes, and that was the vein in which I was speaking. And thank you for that clarity. As I said, and I work there, and so that speaks to the people there. But I just wanted to name what you named, because keeping it very real to show the progress and evolution of an entity where people may have some hesitation across the board with medicine. But this is another level of demonstrated commitment. And so one of the reasons is because getting information out about the vaccination and booster. And so where are we, Dr. Elaborate, with what's going on? I will also make this disclaimer. If you're listening, you are not being examined by any of the medical staff, physicians, nutritionists, dietitians, anyone that's going to come into the space and talk to you about your healthy Java. As Dr. Alabre said, if you have a primary care physician, that's always your point one. If you don't, you need to get one. But I just wanted to make that disclaimer that this is a conversation and give you talking points to talk to your medical physician about, but getting also information out there. So I wanted to make that disclaimer as well, Dr. Alabre and Cindy. But Dr. Alabre, where are we with the vaccination, with boosters, with what the CDC is saying? And just yeah,
absolutely. And again, I do want to echo this, what you just said there. Really, please reach out to your doctors, your trusted healthcare providers, nurse practitioners, and the authorities that we have in this space right now, the CDC, the FDA, and people we know are putting in the work and are doing the work and have the right authorities. And even your state, the state mass.gov has a whole segment on COVID that they've put together. I'd really encourage people to use those sources as opposed to, I don't know, YouTube or whatever it is, where things may not be so clear or so accurate. So where are we? And I want to get back to a little bit of what you mentioned before as well, Jimmy, in terms of sort of the uncertainty and sort of the changes that can be a little bit sort of jarring and confusing to people. And this is really all about, this is reality. Okay, we're all humans. Nothing is perfect. This is an evolving pandemic. Things are changing. And so we expect the recommendations to also change. We expect the new science to come out, the new data to come out. And so I want people to be able to be a little bit more flexible and know that, just because something changes doesn't mean that we were wrong the first time. In science, we typically go by to the best of our knowledge. This is at this moment in time, this is what's available. And with every possible testing and protocols and methods that's available, this is what we know. This is what's known. That may change because everything is also changing.
And this is a novel virus, right?
Exactly.
Novel,
it's
which means new.
It is novel. It is new. And so that does also contribute to sort of how we all navigate this and get to the point we are at each moment in time. And so as the science evolves, recommendations will change. And if the recommendations are coming from your trusted providers, I would also ask that you go along with it. Certainly ask questions, and we want you to understand and be comfortable with it. But at the same time, not put up a block where there is no getting through. So to answer the next question more specifically about Colin Powell is that we've known forever that vaccines are not 100%. So it is right now, when it comes to the coronavirus, the best tool we have to reduce severity, prevent hospitalization and death. I mean, the numbers are staggering.
Can you say that again very slowly, so as they say, the people in the back?
Sure.
Please.
It is the absolute best tool we have right now to reduce the severity of the disease, to prevent, for the most part, hospitalization, and reduce death. And I can give you one quick number. I'm looking at the chart right now from the CDC. So among vaccinated people, 80 years of age or older, so these people who are 80 years or older are 13 times more likely to die of COVID than the average of all age, okay? And so that goes back to that there are going to be some fails. And we know that age is a big factor. We do know that people with certain conditions are also at higher risk, having cancer, undergoing cancer treatment, and all this. So I don't want anyone to feel that if someone dies of COVID, that doesn't mean the vaccine failed or the vaccine wasn't good. It's just, again, nothing is 100%. No one is perfect. And so we do reduce a lot. And so just to give you another example, so this is, being older increases that risk, but also being vaccinated changes everything. So let me give you one more here. So the latest data from the CDC for unvaccinated people of all ages and vaccinated people of all ages. So we have right now about 114 people per 100,000 of vaccinated people are getting COVID, as opposed to 666 per 100,000 who are unvaccinated. So the difference is huge. So that's just getting it. It gets even better because even the people who are getting COVID after being vaccinated, which is a lot lower than the people who are vaccinated. But when we look at deaths for people who are vaccinated and unvaccinated, that's where the difference is even more staggering. So right now, the latest data for people who have been vaccinated, we have about 0.7 have died of COVID after being vaccinated, less than 1 per 100,000 versus 9.1 out of 100,000 who are unvaccinated. And that's for all comers, all ages. So more than 9 times more likely to die, and we're talking in numbers for the recent months with the Delta, than people who are not vaccinated. So the difference is there, and we believe it works. And we also understand that there are going to be people with other conditions who may not fare as well. And so that is not to discourage anyone. This is not to say that the science didn't work. The vaccine is bad. We just have to look at the numbers. What if they didn't get it? What would it be? And when, so, I don't know if that answers your questions.
No, it really does. And I don't know, Cindy, if you had any more. And I'm looking, we haven't really got questions in today's session, but we have about 9 minutes left. If there are some specific questions, we'll test and do a couple today. And going forward, we will, Dr. Alabre had referred to what we would usually call a slide deck. And we're going to be able to incorporate that so you can see these numbers while he's talking in real time. But the overall message that I heard, and Cindy, you tell me if you disagree or agree, is that you fare better if you get vaccinated. I've been saying all along that a whole lot better. And those numbers are staggering to under 0.1% that have died, that have got it. excuse me. And then you said 9 point or 0.9?
9.
9. So
9.1.
yeah. And it's funny, Dr. Labre, and I don't know if you saw this, and I just thought about this in real time. I have a question. I've noticed, and we just want to hold space because we do believe in, we do support mental wellness and mental health here. But by looking at props post, I've noticed a lot more posting on social media about deaths due to COVID. I've just by looking on social media, there was, the big when we had the surge last year, and then it hasn't been as much. But for the past 2 or 3 weeks, I've just noticed a few extra more. Is that with what you know now? Is that something that you have noticed as well?
So again, like I was mentioning before, I know it's hard without seeing the
Yes.
graphs and the numbers, but one of the reasons I mentioned that the people who are 80 years of age or older are 13 times more likely to die, that really was to put in perspective that when we say 0.7 people vaccinated have died versus 9, that 0.7 includes all these 80 plus years who are actually also dying. So when we talk about younger people with that risk, that number is a lot less. And so we do know there are different factors. And so that actually was a good segue. I wanted to go back to the question you asked me earlier about where we are in boosters. So what we know right now from the science is that the immunity, your protection against the virus, does go down after months of getting vaccinated. So your protection is not the same as in the first few months of getting the vaccine. And so that certainly will lead to higher deaths and higher hospitalizations. We also know that the Delta variant is a little bit different, quite different than the previous variant, and that people are getting breakthrough symptoms with Delta after vaccinations. And so people are also a little bit more likely to die from the Delta variant after vaccinations, which brings us to boosters. And so what's been found after lots and lots of studies that getting a booster right now will increase your response, your immunity, again, back to original. And in some cases, some studies had even better than the after the first vaccine. And so it is important that if you are one of the people at higher risk, that you follow the recommendations and get your boosters, because it will reduce your risk of getting symptoms or possibly getting hospitalized or possibly dying. And so right now, the recommendation is for all 3 of the vaccines we have available in this country: the Moderna vaccine, the Johnson & Johnson, and Pfizer. And so the first one to get approved for booster was the Pfizer, and now we have Moderna and Johnson & Johnson also part of that list. And so that also, I wanted to briefly mention that these recommendations just don't come lightly. This is after months of data and hours of work and lots of different places. And just to give you a sense of the process we have right now, so the drug manufacturers, the vaccine makers, obviously have to do all kinds of testing, show that the vaccine works and that it's safe to use. After all kinds of works, then the FDA, the government organization that reviews all that data, also has to confirm that what they're hearing from the drug makers, the vaccine makers, are real, true, that it is safe and that it works. So another whole layer of safety checks and confirmation has to go. So then the FDA will approve the drug, meaning that it is safe and efficacious, it works, and it's good to use, and you're not going to die from it, or the risks are not enough to not use it. So benefits outweigh the risks, basically. And then the CDC has to review all that again and say, okay, it is safe and it works, but is it the right thing for the population? So that's sort of like the last layer of that recommendation, is to go through the CDC and say, so this drug is good and it's safe, but is it what we need right now? Or will it do the work that we need, which is to slow down this pandemic, to reduce the mortality and do all these things? So they again have to review everything and then make the final recommendations as to who gets it, when you get it, and all that stuff. So this is not something that just came out of nowhere. I don't trust Pfizer, I don't trust Moderna. This is, I mean, we're talking about this sort of massive undertaking at all levels of confirming the safety and the efficacy of this vaccine.
Thank you. There are a lot of questions, and I'm going to try to, in my case, figure the one that I guess the main thing I want to know, and if you could answer in, you got about 2 minutes. The first one is to ask and answer both questions is, who is eligible right now for the booster shots?
Mm-hmm. So for the booster shots,
yep.
Right. So people who are 65 years old and older, people who are at high risk, and there are two facets to that. The high risk means people who are at high risk of getting sicker or possibly dying from that virus if they were to get it, which means people who have lower immune response capabilities, people who have cancer, people who are undergoing certain treatments where the immune system may not work as well. And then other group for high risk is people who are at high risk of contracting the virus based on their occupation. So we do know from the CDC now, people who work in healthcare, people who work in teaching, people who work in public transportation, people who work in grocery stores, because you're coming into contact with lots and lots of people. So your risk of contracting it is a lot higher than someone who may not have as many contacts. And so the recommendations based on availability and social justice and priority, they couldn't recommend it for everyone, because then we would miss out on the people who are, again, at highest risks. And so that's what we have currently. That may change as more of the vaccine becomes available, or the people who are at highest risk are vaccinated. I think it will be opened up to other people.
Got you. And I got one more to get in. This is so important. And I know so we're looking at like agenda, and one thing that Dr. Betancourt said, and Dr. Labre, you noticed when you first came on, that this is going to be driven by the audience. And so we have some topics lined up, and I'll figure out something, because there are a lot of questions about the variant. I guess I'll surmise to the one that's showing. And again, it's 10. It's up to you. I have a couple of minutes to spare. We do have a personal experience session at 10:15 where someone's going to talk about the benefit of them being vaccinated. But real quick, is there a Delta Plus variant? Yes or no?
So that's being looked at. We haven't gotten the full report on it.
Okay. And then the Mu variant, is there a Mu variant?
Yes. So as I think that was a few weeks back, we mentioned that the virus is changing all the time. Yep. And so what happens is that when it's different enough, when it acts differently enough in terms of how it infects people and how it makes people sick, it will then be given a different name to just differentiate it, because it's that much different from the previous version. And then we have to wait and see actually what it really all means, because I think I mentioned before that some of the changes in the virus may make it weaker, and some of the changes make it stronger and more infectious and whatnot. And so those exist. We just need to sort of figure out what it really all means for society, for people, for the vaccine, and everything else. And so we do have to wait to get the final data on that. This is at the research level, not
Thank you. So one thing I want to clarify is this was the introductory announcement premiere of Your Healthy Java. And so some of the context introductions will not take up as much time as we took today, because the priority is answering your questions and getting information. And there are just to let you know, Dr. Oliver, if you have time and get a chance, where our guests can and are on social media, and sometimes I'll cut and paste and get them some questions we weren't able to answer, but sometimes our guests will be able to go on and interact with you, not guaranteed. But what we'll do is I'll try to get some, Dr. Labre, if you can forward me information so folks can do homework or whatever. We'll get information out. But as Dr. Labre said, you can go to the state's website for information about vaccinations. You can contact your primary care physician. You can call 311 at the city level here in Boston. You can call 211 at the state level if you're not in Boston to get information about where the vaccine is available. And again, we're coming back in now 2 weeks. Next week would be election week, so we're not coming back next week, but November 9th, we are coming back, and we're going to talk a little bit deeper with Dr. Labre about maybe begin a little follow-up about updates on variants and vaccines, but we're going to spend that time to talk about, do a deeper dive into getting back into care and why routine and preventative health care is so important to us across the board. Cindy, Dr. Labre and I have talked a whole lot. We're just going to ask you to maybe close out. And I have a link that Dr. Labre sent here, so I'm going to go and put it in the comments. Cindy, closing remarks. Well, Dr. Labre, if you could give closing remarks, just finish up real quick. And then Cindy, you can close as our outreach person.
Sure. I think you've said it all, really. I mean, we're very excited about this project, and we're looking forward to hearing from everyone about what concerns them, what more information they'd like to get, how we can direct them to the right sources, and whatnot. And so we will certainly be having lots of different topics, from mental health to cancer screening to dental care, nutrition. And so we are really excited to hear from the people about what they're interested in. And I know Cindy and you, Jimmy, also are in very close contact with the communities, with the different groups in the Boston area. You are hearing what's being talked about. We're also watching social media and see what the discussions are. And so we'd like to help and cover those topics and bring about understanding and hopefully care. And so this was just the beginning. This is the introduction, and we're certainly looking forward to a whole lot more.
Cindy?
So I wrote my response in the comments that this is a blessing for people in the community to be able to ask questions and have them answered in real time. I mean, this is something that doesn't happen. And it's because of your platform, James, that you've created this, that people can talk to professionals about what their concerns are and have real answers at the same time that they're asking them. And I just want for folks to save the date for the 9th and get other people to tune in as well, because this is very important that we are able to do this in this space and talk to people that we actually know. I look at who's listening. I'm like, oh my goodness, she's on and he's on. And, you know, these are questions that people ask me in the street, but now we have the professionals answering the questions and people that will have other topics for you. And you're able to help us to guide what those topics are as well.
Cindy, thank you. And I just wanted to end with, there was, and I wasn't able to put them all, but there were a lot of references to the wonderful care that people have received at aneurysms being removed, wonderful care from one of the charter members here in the Java Cafe. And so shout out to Mass General Hospital, not just for supporting this, but the history of, and as a Dr. Labre pointed to, the intentionality of really ensuring that there is equity. And again, to Dr. Betancourt and the entire team, thank all of you. So we're going to go. Natalie is in the room. I just have to. Natalie, what's up? Hold on. Let's just, they know why I'm doing this. When you're in medicine, you want to stay very close with the executives and the operations folks. And so, Natalie, thank you for all your support, late night emails, weekend emails. Thank you for all you do and everyone there. Thank you so much for tuning in to the first episode of Your Healthy Java. We will be back 2 weeks, November 9th at 9 a.m. Thank you all so much and have a wonderful day. And remember, Your Healthy Java. Thank you.